Let's learn about how to use the newest guide kit. This guide kit enables accurate implantation, preventing alveolar bone absorption and fixture and abutment fractures and screw loosening in cantilever-shaped prosthetics. Using the newest surgical guide kit do not require any additional equipment such as intraoral scanner, and there is no cost and wasting time for producing the surgical guide. The newest guide kit is made of titanium, available for autoclave and reusable. It is made of a waterproof structure that allows internal water injection to prevent periodontal necrosis. The Easy Guide Kit allows implants to be implanted without additional drilling. This guide kit provides space for storing third-party drills and can be used as a custom kit. The Easy Guide surgical kit can be used for both single-case and multi-case surgery. Unlike another normal surgical kit, if we are using the newest guide surgical kit, the newest guide kit can be used in the second surgery. They also can be used to continue the second surgery in the multi-case. It can be easily drilled even in thick gingiva and irregular alveolar bone. The extraction socket guide function is a unique feature of the newest guide kit for preventing the vibration that can occur during drilling and helping to place accurately in the desired place. Let's learn how to use the newest guide surgical kit in the first case surgery. Fasten the guide cylinder to the guide drill. Drill vertically after adhering to adjacent teeth. Fasten the guide cylinder to the guide pin to check the path. Use 2.8 drill in the case of 3.0 fixture. Check the path by tightening the guide cylinder to the parallel pin. After checking the path, drill following to the standard of fixture. It is possible to place fixtures the same number of times as the existing procedure without additional drilling. The Honorst fixture includes a cover screw as a default. Next, we are going to talk about the second surgery case. Fasten the same guide cylinder to the tissue punch as the first surgery. Punch vertically after adhering to adjacent teeth. Remove the cover screw. Fasten the tissue punch to guide pin. After inserting the tissue punch into the guide pin and repeating it up and down several times, thick soft tissue is also easily perforated. In the case of abutment 6.0 or 6.5 diameter, user can use the 4.8 diameter tissue punch. User can also choose the suitable tissue punch for tissue guide punch following to the color. Tighten healing abutment. In the multi-case surgery, the size of the guide cylinder can be selected by measuring the size of the opposite tooth. Drill vertically against the adjacent teeth by using the guide cylinder. After inserting guide pin, guide drill for next tooth after adhering to adjacent teeth. Check the path after inserting guide cylinder into the guide pin. Drill according to the diameter of fixture. The ONT1 taper drill consists of an entry section and an extension section, allowing 6.0mm fixture implantation with just 4 drills, including guide drilling, to reduce implant surgery time. In the multi-case, after removing the cover screw, fasten the cylinder guide pin drill in the next implantation site. It is possible to continue drill up to 3 bone bridge cases only with the basic configuration. There are 3 different types of tissue punches, so dentist can select and punch a tissue punch which is following to the specific abutment. After removing the cover screw, fasten the healing abutment. The Honorst healing abutment is coated by the color, so user can use the same color healing abutment with the impression coping.